Welcome back to New Wave Therapy. Bob Burdekin here with my wife Bertha, and today I want to talk about the depth of penetration that's achieved with the various light devices and showing you the depth that's achieved by those same devices. In addition to that, I want to explain to you some additional uses of the various therapy lights, as well as show you some of the more beneficial ways to use the light to be able to receive the greatest benefit to both yourself and to your client. I have some graphics today to help you better understand what I'm talking about here. The first graphic I want to show you, it will relate to the depth that the different light therapy devices and how deep they penetrate through the various layers of skin. So let's bring the first one on. The first light I want to cover is the blue LED therapy light. And you can see by the graphic that the beam of light only affects the first layer of skin. Now this has a powerful antibacterial property for the treatment of acne without irritation. It reduces oil production, it also prevents future breakouts, and offers a UV-free alternative to aid in the maintenance of eczema and psoriasis. It's also been successful in the management of a skin condition known as lentigo, which is the condition marked by small brown patches on the first layer of skin, and it's typically found in elderly people. The second light I want to cover is the green LED therapy light, and here again you can see that the beam of light penetrates both the first and the second layer of the skin. And green light can help to reduce chronic pain, which is caused by fibromyalgia, by migraines, or even arthritis, just to name a few, and it can do so by up to 60%, according to an article in the journal Pain. Now, green light has been helpful in aiding to manage a skin condition known as spider nevus, which looks like red lumps or bumps with blood vessels radiating out in a spider web-like pattern from the center. Moving on to the red LED therapy light, you can see that it penetrates the first, the second, and even the third layer of skin. In fact, it goes a bit past the third layer of skin. And the use of the red LED light is known to increase hydration levels, reduce redness, reduce inflammation, shrink the appearance of pores, regulates oil production, accelerates skin repair, and is medically approved treatment for rosacea. Red light has also been helpful in the management of a skin condition known as Becker nevus, which is a non-cancerous large brown birthmark occurring mostly in males. It can be present at birth, but it's usually first noticed at puberty. It typically occurs on one shoulder and upper trunk, but it occasionally occurs elsewhere on the body. Another skin condition that has a history of successful management is that of telangiectasia. It appears as a red, blue, or even a purple linear mark that measures less than 1 or to 3 millimeters in width and is several millimeters to even centimeters in length, and they disappear when you press on them with your finger. One last skin condition that has been aided is that of varicose veins, sometimes called leg veins, which are twisted enlarged veins. Any superficial vein may become a varicose vein, but it's mostly common in the legs. Here, I want to discuss the near-infrared therapy light, and looking at the graphic, you can see that it penetrates deeper than the others. In fact, it goes into the muscles, the soft tissues, and even into some organs. Now, this is the deepest level of penetration for absorbed light. It will increase cell permeability and absorption, smooth lines and wrinkles, improve elasticity, reduces pain and inflammation, and even accelerates wound healing. This particular setting within the light spectrum has a particularly strong ability to penetrate deeper into tissue, the organs, and the joints. This makes it ideal for enhancing muscle recovery and reducing joint pain. Now, through the use of this graphic, I do hope that it's given you somewhat of a better understanding of how the different therapy lights operate and penetrate. So we're back, and now that you've seen how the different therapy devices handle different levels of penetration, it might be good to show you an additional graphic, and that one will put it in a better perspective as how it relates to the use on the human body. This graphic should give you a much better understanding of the ability of each of the 4 previous therapy torches that we covered. So let's move on to the second graphic. Using the silhouette of a human figure will hopefully give you a better understanding of how the different therapy lights work and at what depth they penetrate to. First, the blue light. And just as in the previous graph, you can see its ability to penetrate is quite shallow. Next, we have the green light. And the green LED light once again goes somewhat deeper than the blue light, and we start to get somewhat better penetration than with the blue light. Bringing in the red light, and finally we start to see better penetration. But finally, the best penetration comes from the near infrared light itself. I do hope that the use of this graphic has made it somewhat easier to understand when we talk about the penetration as far as how far the lights actually work within the body itself. I do hope that using these graphics have made it a bit easier for you to understand how deep that various therapy light devices do penetrate through the various levels of skin and even throughout the body itself. Now, the last graphic I want to share with you is the best way to work with your red LED therapy light. And this last graphic will help you understand why the light device is best held directly on the surface of the skin. Even though it appears as a red light source, the application is the same for any of the light therapy devices, be they red, blue, green, or even the near infrared light. So, on to the graphic. In this graphic, I'd like to show you the different contact methods of using the therapy lights. As you see on the screen, I'm showing the non-contact method. This is when you hold the light anywhere from 1 inch or even further away from the skin. And when you do that, what you see is that you lose the light intensity, mainly because of light scattering in many different directions. You've got no control over it. And secondly, you get losses due from skin reflection itself. And the last part in this situation of non-contact is you don't get the penetration that you're actually looking for to do the job that you want the light to do. Now, when we bring in the direct method of contact, the results are somewhat different. Even in the penetration, it's almost double or even more. And in fact, we have minimal diffusion and refractive losses. So if your application technique is either non-contact or contact, it's important to really understand for you to get the maximum benefit that you are looking for when you're using the light itself. So there you have it. And I do hope that these graphics that we've created will give you a solid understanding of how deep the penetration that each therapy light will go into the body, and that they have a specific function and are used for specific protocols. Lastly, remember that the direct contact method is the most effective method for applying light therapy and generates the greatest results. So until next time, this is Bob Burdekin and my wife Bertha saying thanks for coming by.